Hello and welcome to this webinar providing a briefing on Health Justice Australia's forthcoming report, Mapping a New Path, the Health Justice Landscape. I'm Tessa Boyd-Kane, I'm CEO of Health Justice Australia, and it's my pleasure to welcome you to this webinar. We begin by acknowledging that we undertake this webinar and many of our listeners will be on Aboriginal land that was, is and always will be Aboriginal land, and to pay our respects to Elders past, present and emerging. The purpose of today's webinar is to give you a preliminary view of results of our mapping survey of services and partnerships on what we are calling the health justice landscape. We are particularly keen to share this information with practitioners who've provided key data and with researchers, policymakers and others who are interested in the possibility of health justice partnerships as a way to address unmet need for particularly vulnerable communities. The structure of this webinar will be a combination of content from the mapping report and slides that provide some key data. In a moment, I'll pass over to Health Justice Australia's Research Director, Susie Farrell, to take you through the key slides and provide some of the context to the data that we're presenting. In addition, this webinar is prepared to time with the release of the Mapping a New Path report, and that will have much more detail about the data, the findings and the context of these services. So I'd like now to introduce Susie Farrell and hand over to her to provide the key briefing.
Hi, and it's really exciting to be here with you and to take you through this first piece of research that we've undertaken at Health Justice Australia. So the mapping survey was actually sent out in August 2017 to all the services in our network, seeking information on the list of topics that you can see here. And I think it's important to acknowledge that this was really our first survey and a bit of a pilot, and we've already identified how we could gather even richer information in future. But the purpose of the mapping has been twofold. First, to provide an overview of the health justice landscape at that particular point in time, the services, the locations, partnerships, the types of clients served, the other activities undertaken within partnership and the like. And that's what we'll focus on today. But the second purpose is really to help us understand and define what it means to be a health justice partnership, what it is and what it's not. And a key reason for that is when we ask questions like, well, what works? We need to know what the what is, what a health justice partnership is and how it can make a difference. And in separate work, we'll be looking at what working means, what success is and how that's measured. So bearing in mind that our network is made up of practitioners who self-identified their service as a health justice partnership, we received responses from 48 services around Australia. And reflecting what we know about the network, we saw around half of these are in Victoria. More than a third are in New South Wales, with the remaining in Queensland and around the other states and territories, except for at this point, Tasmania. We also mapped the services against the remoteness classifications used by the Australian Bureau of Statistics. And what we find is that 3/4 of all services are in major cities, which include, of course, all the suburban areas. One is in an area classified as remote, and the others are in what are called inner or outer regional areas. And you'll note we're going to be talking about services rather than health justice partnerships. And this takes us to our first observation from the mapping survey. And that is that on the ground, there is no single or unanimous definition, I should say, of a health justice partnership. The survey indicates that there are a range of services that identify as health justice partnerships, and yet these self-described HJPs can actually differ significantly from each other. So informed by the range of ways that health and legal services are coming together, we've begun to talk about a health justice landscape, which really acknowledges the variety of service models on that landscape. And that variety will in turn be reflected by issues like varying client need, different service contexts, and the differing opportunities to partner. And looking across the landscape of respondents, we identified 5 separate models, the ones that you see here: partnership, integrated services, outreach, service hubs, and student clinics. Now, that's what we saw just among the respondents. Of course, there could be many more ways that health and legal services come together. However, for this report, we've made a decision to include all the respondents in the analysis and discuss a health justice landscape rather than just health justice partnership in the narrower sense of the word. And there's a few key reasons for this. First, as there is no clear consensus on what constitutes an HJP, and in fact, one of our tasks is to help clarify that. And having not yet done that work, we didn't feel that we're in a place to exclude any respondents. And the other benefit is, though, by understanding an analysis across the landscape, it's much clearer to see what something is by identifying what it's not and to think about the particular points of difference, which are sort of many and varied. And of course, yes, models do vary in a number of different ways. So the presentation today will take you through some of those domains with which service models may differ: service setting, the types of services provided, but again, we report all the services together. So moving on with the data. Here what you're looking at is the cumulative number of services on the health justice landscape based upon the year that each respondent said that their service commenced. And what you're seeing, of course, is significant growth, particularly from 2014 when there were 7 services to 47 by the end of 2017, and then one more started serving clients in January 2018. And you can also see from that slide where there has been funding input into the health justice space. You'll also note that Health Justice Australia was established in 2016, which really reflects us evolving from this network of partnerships. So where are the services based? Noting that some partnerships have more than one setting, so we have 55 settings in total, just under half were in hospitals, one of which were public or not-for-profit hospitals. A third of service settings were community-based health services, including mental health services, maternal and child health, and even home visits provided by district nurses. We see 8 services in Aboriginal medical and health services and 6 in other settings, including a housing estate, community services, and even a school. And here we're looking at the clients or patients that the services were targeting. Now, around a third said they provided services to all the clients of the health service, which was which was open to the general community rather than a very specific group. But the other services targeted their assistance at particular client or patient groups: women facing domestic and family violence, Aboriginal and Torres Strait Islander people, people living with mental health and/or alcohol and other drug issues, older people, and one was focused on younger people. And again, noting we can have more than one health and/or more than one health partner in a partnership, we see on the health side that public or not-for-profit hospitals were partners in 21 services, but also area health services were partners in 7, but 4 of those were in addition to the public hospital partner. We see community-based health services partnering in 14 services and Aboriginal community-controlled organisations as partners in 6 of the services. On the legal side, community legal centres were involved as legal partners in 3/4 of all partnerships and legal aid commissions in nearly 30%, and that overlaps because some of them were together. So here we're really looking at the types of legal problems or social determinants of health, depending on your perspective, that services can assist with, and the nature of the legal help that they provide. So starting with legal matters, while only 1 in 5 of the services targeted women facing domestic violence, nearly 9 in 10 provided assistance for family and domestic violence issues. And more than 3/4 said they provided family law assistance. But again, and this goes back to the nature of the questions we asked, we're not sure if that is family law as separate and discrete from family and domestic violence. And that's the kind of thing we do want to explore in more detail in future surveys. But what you're also seeing there are the range of kind of civil law issues, housing, credit and debt, fines, social security, those issues of everyday life that are really coming through the health justice partnerships. And what we found really interesting in these results is it's the type of legal help they're provided, and it's not just advice. People are being provided with more intensive assistance through the health justice partnerships. So nearly all provided minor assistance, and that includes things like writing letters, contacting the other side. 2/3 were able to provide representation, either directly or through a very warm referral relationship with another service. Yes, and only 6 services that said they didn't offer any advocacy or representation directly or through referral. But the other interesting thing we wanted to point out here was this idea of shared case management. And Tessa, I'll pass back over to you for that.
So one of the questions we've been interested in exploring in this mapping work is the difference between health justice partnerships and other services already operating in either a health or a legal setting, or indeed with each other. So this finding around shared case management in a number of the services that we mapped is really significant, because it starts to help us understand how health justice partnerships might differ, for example, from outreach services. We know that many community legal services have been providing outreach into health settings for a long time, but that outreach doesn't necessarily mean that those lawyers are working with health professionals in that setting or are coordinating their service with the health services being provided. So we think case management is a really good example of what it is that you might be doing through a health justice partnership that is different from some of the other services already in this space. Back to you, Susie.
Okay. The survey also asked several questions to explore what partnership looks like on the landscape, and we're going to take you through some of those now. So first up, we asked respondents to rate their partnership on a scale of integration. And as you can see from here, 22 described their partnership as a collaboration, the highest level of integration or partnership on that scale. And another 12 defined their partnership as coordination. And I have to say, we're pleased to note that no services said that they were not aware of their partner. Those at that end of the awareness communication end of that scale could be some of the more outreach type services that responded to our survey. So they still involve partnership, but not up to perhaps to the same intensity as a fully formed health justice partnership. We also asked whether partnerships had an MOU, and you can see around 2/3 who answered this question said yes, their partners had signed a formal MOU. But this didn't seem to differentiate HJPs from other services such as outreach. It probably is what is in the MOU that is more pertinent, and that's something we really, again, want to explore in future surveys. Okay, the literature on partnership often points to partners having shared goals as a key element of partnership over and above the separate goals of each partner organisation. And most of our respondents indicated they had shared goals or outcomes. And generally speaking, the shared goals outlined were either the same as or a combination of the goals of the health and legal partner separately. And noting this, the most common goals, as we categorised them, were improved access to legal help for the patient or client group served, improved health or wellbeing by addressing health harming legal need, and also aims around the provision of holistic or integrated services. And I think particularly as health justice partnerships are relatively new on the landscape, we're seeing a lot of interest in better understanding what partnership actually looks like, and that also being a goal of the work as well, which I think is really interesting and valuable. There were also a few goals expressed around improving staff capacity, client capability to address and identify and address legal issues, and also around systemic advocacy, which we'll come back to. Another indicator of active partnership or an active relationship between partners is client referral between the two organisations. And as we might expect, with legal services being cited in health settings, we see more formal referral formal referral processes from health staff to legal staff. 10 respondents indicated there were formal referral processes from the legal back into the health, and nearly 30% indicated no referral processes at all in that direction. But what was striking in the data is the high proportion of informal referrals from legal staff back to health staff. And we're beginning to think that might be a real indication of strength of partnership with that sort of two-way communication to address the needs of the client. We also asked about secondary consultation, which involves a lawyer providing advice to or information to a health professional about their client, or vice versa. And again, secondary consultations are indicative of a high degree of collaboration, indicating trust between the partners, together with a degree of understanding about the framework in which the other partner operates. So that is recognising obligations around mandatory reporting for health services and confidentiality and privilege for the legal services. And again, across services, we saw secondary consults from lawyers to health professionals, as well as secondary consults the other way. We're also really interested in looking at interdisciplinary training as a feature of services on the landscape. And again, as you can see here, nearly all services involved lawyers providing training to the health staff. And that was on issues such as how to refer clients into the legal service and also how to identify legal need. 29 partnerships indicated that the health staff had also provided training back to the legal staff, most commonly about the health service provided and how to refer clients back. But in about 13 services, they were providing information about the nature of the health issues actually facing the client. I mentioned systemic advocacy earlier. Just over 1 in 5 respondents reported that their partnership was involved systemic advocacy as a partnership over and above any systemic advocacy undertaken by their respective organisations. And we're really interested in this. Shared systemic advocacy is both indicative of effective partnership, as it is a truly shared activity between the partners, and it takes that partnership to happen. But it's also an activity that can have an impact for the client group beyond those clients who walk through the door. With the shared voices of both service partners and the experience and voice of the client, this is a key vehicle for systemic change. And now to funding. While some respondents indicated change in funding over time, what you're seeing here is that half said that most of their funding came from government. And that can include HJPs being funded from the core service funding of the legal service, as well as from separate grants. Around a third said their funding came from non-government sources, which included philanthropic funding and grants from statutory bodies such as the Victoria Legal Service Board. 3 said that they had funding from both government and non-government sources, and 5 did not know or didn't respond. But we asked respondents more generally, what were some of the challenges in setting up and running an HJP? And Tessa, maybe you'd like to talk a little bit more about that.
Well, certainly the impact of short-term funding and the lack of specific funding for the health side of partnership were raised as key challenges by practitioners who responded to this survey. And that's something that Health Justice Australia is really concerned about, because on the one hand, we're showing through this mapping work a significant increase in interest in working in this way. On the other hand, even for health justice partnerships that now have several years track record, they're still being funded as though they're pilots. So in terms of how we connect the outcomes that we're wanting to see from these partnerships with opportunities for funding, that's clearly an area and a priority for us as well as for services into the future. So that's a taster of the data that you'll find in our forthcoming report, Mapping a New Path, which looks at the health justice landscape based on this 2017 data, and that is released 30th of August 2018. We've been really keen to get feedback, particularly from practitioners who provided the data on this work, and in a moment we'll talk a bit about the engagement that we've done with those practitioners. But first, we want you to know the range of resources that we're providing as part of the release of these data. In addition to the report, Mapping a New Path, we're also working on a second piece of work that informs a discussion about the service models themselves. Really, this closer look at partnership is to help us understand what it is about this work that is different from other services. And that, of course, has really clear implications for how we might evaluate the outcomes of this work. And then a third piece of work, building better partnerships, draws 3 key lessons from health justice practitioners' responses to the mapping survey around questions such as what worked well, what were the challenges, and what would they do differently in establishing their partnerships and their services. Susie, it would be good to hear at this point where you think our current thinking is in terms of what it is that makes a health justice partnership.
Yeah, this is a really interesting question, and I guess for us it's still an evolving question and something that we are really keen to keep a dialogue open around. But as you can see from the mapping, and this is just one group of respondents, that health and legal services are coming together in a range of different ways. And I guess for us, the purpose of beginning to think about how models differ is to understand the purpose, the features and the best fit of each, and to inform decisions about when it may be most appropriate to pursue a health justice partnership model and when it may be more appropriate to pursue a different model. So as we seek to build our understanding of what makes a health justice partnership, again, we want to engage with you about the elements of health, of legal and of partnership, with our thinking at the moment being that health justice partnership really sit at the nexus of those 3 things. They have elements of legal, they have elements of health, but they also importantly have elements of partnerships. And each of those things also contribute to the outcomes that health justice partnerships can achieve. So when we're thinking about health, we're looking at health settings and or health services and or health practitioners. So it could be that the partnership is not necessary in a health setting, but as the example of district nurses with district nurses in a community setting. So really exploring and understanding what that means. And what about the legal help? As we've seen from the survey, the partnerships here are providing assistance beyond simple advice or information, and recognising the complex needs of the clients that health justice partnerships seek to serve, that would be an appropriate thing. Also, what is the range and complexity of issues that are seen in a health justice partnership, and how are these services equipped to address those issues, noting how those issues then have impact on health issues. And then partnership, what's important there? We know from the literature that shared goals is really important, but also shared activity. And what about shared benefit and support? And of course, there needs to be partnership structure. So they're the elements we're beginning to explore when we try and unpack what is a health justice partnership. Tessa, did you want to add to that?
Well, I think it's important to remember again why we're doing this work. So in terms of priorities for Health Justice Australia, the really key question we want to be able to answer is what works? What is the difference that's being made by health justice partnerships? And so in order to understand that, we need to know what they do. But of course, that speaks directly to a follow-up question then, which is what does it take to do this work well, and how do you invest in that? And if we're saying that there's something about this way of working that is different from existing services, then we also need to recognise that requires different levels of investment and different resourcing. So for us, this is really laying the foundation for an ongoing discussion, a discussion that we continue to have with practitioners, with researchers, with policymakers and with funders. And while we're not necessarily at the point of providing definitive definitions at the moment, we see this mapping work as a really key next step in being able to answer some of those questions. Well, that brings us to the end of the formal presentation of data. As we've mentioned, we've been testing some of these assumptions with a range of stakeholders in this space, particularly because it is Health Justice Australia's first and foundational report. And so we've engaged with the practitioners who provided data into this survey in the first place, across the community legal sector, with health practitioners, and as I've said, with researchers, policymakers and funders. We've also been conducting workshops and webinars like this one for a range of reasons. One is simply to get the findings of this work out there and to use it as the basis of discussion with other people who share our interest in understanding this work and the value it can bring. And so we see this work as a real opportunity to build knowledge, but we're also really interested in translating that knowledge into driving effectiveness in service delivery, and the purpose of that effectiveness is first and foremost for the people who need those services. And so we're really keen to encourage practitioners to continue to provide support to Health Justice Australia's work in the contribution of data about what it is that practitioners do as a really critical way of enabling us to help understand the difference that this work is making. Now, we're finishing this webinar with some contact details on the screen. The webinar has spoken to the data that will be released in a report, Mapping a New Path, Health Justice Landscape 2017, and that report is available from 30 August 2018. In addition, there's a range of ways that you can connect with us and with other practitioners working in the space. And you can currently see the connection to our Partnerships Director and reference to our practitioner network on Yammer. And we certainly encourage you to join that network if you're a practitioner already working in this space or interested in this space. You can also follow us through social media at Twitter and our LinkedIn account, and you can sign up to our mailing list via our web link, which is also on the screen in front of you. We hope to hear from you. We would welcome feedback to the email address you can see in terms of whether you found this webinar useful, any feedback that you have about the mapping report, and particularly any work that you're doing that might speak to activity on the health justice landscape. At this point, we'll sign off. So I'd like to thank my colleague, Susie Farrell, Research Director at Health Justice Australia, for the analysis and the rigour that she's brought to the work that we've been able to brief you today, and certainly to the report that we'll be releasing shortly.
Thanks, Tessa.
Thank you.